We can increase the height of a person through surgical methods, and basically there are two type of surgical method which are very common. One is external fixator limb lengthening surgery and one is internal limb lengthening surgery. So in this video I am going to explain what is the major difference between these two surgeries and how we can increase the height up to 3 inches in people. So when we talk about the external limb lengthening, so this is a fixator known as Alizarov. There are different designs of systems which are circular also, which is linear also, railrod system, which can increase the bone height. When we use these kind of systems, the pain is generally a bit more as compared to the internal limb lengthening when we use a mechanical rod. Now these kind of internal limb lengthening comes in two forms. One is magnetic and one is motorized. So this is a motorized system. There is one more internal limb lengthening which is known as precise, is magnetic. This is fit bone and this is a motorized system. So in first difference is the pain. Why? Because when we use the external fixator, the pins goes from the skin to the bone. So when we increase the height, there is a tethering of the muscles which can cause the pain. The tethering of muscle doesn't happen in internal limb lengthening because everything is inside, and we can increase the height of the nail through a remote control which is operated by a patient himself. Second difference is that, as you can see, this is cumbersome to maintain. It stays on the patient leg for up to 1.5 to 2 months. So it is difficult for a patient to maintain it with a big fixator on both the legs. There is a little bit chance of infection also because the pin is going from outside to inside, and there is a tibia nail also inside this tibia bone and femur bone. So if there is an infection on the pin and the pin is communicating with the rod, then the infection can go in the whole leg and non-union and other kind of different complication can happen. This infection chances is significantly low with the internal limb lengthening. Also, the skin scars is very less with the internal limb lengthening and it is more with the external limb lengthening. So basically, if I want to say, the complication rate is less with the internal limb lengthening, the pain is less with the internal limb lengthening, and second thing, the scars and the skin condition is much more healthy if we use the internal limb lengthening. The only drawback of internal limb lengthening is that it is very expensive because the rods which we put inside the bone, femur and tibia, these are very expensive, and if you are someone who is not concerned about the cost, then India is the best place for internal limb lengthening, because as compared to the Western world and other countries, we offer much reasonable cost height increase surgery with a good rehabilitation, because the rehab is a key in height increase. Surgery is a smaller part, rehabilitation is a very big part. So we see the patient every day. We send our physiotherapists to the patient room every day. They do the physiotherapy by themselves and under the guidance of a sports physiotherapist for at least 6 months. If you have any queries about these two systems, or if you want to get your height increased by 3 inches, you can surely contact us and my team will definitely contact you soon.